And welcome into this edition of Community Action, a program devoted to Maine's 10 community action agencies, put on by Maine's 10 community action agencies and the Maine Community Action Partnership. And we've been exploring different aspects of the COVID-19, the virus, as well as the vaccine in these webisodes that we've been hosting. And we're going to continue that discussion with three very special guests that are joining me on this edition of Community Action. I'm very pleased to welcome on the upper screen with me on the upper part of the screen, Iman Hussein, who's with the Immigrant Resource Center of Maine. Iman, welcome to the program. It's great to have you.
Thank you.
I'm also joined by Bright Lucasa, who is the with Prosperity Maine. And Bright, thank you very much for joining me as well.
Yeah.
And lastly, I'm joined by Dr. Corey Anderson, who is an OBGYN physician at Mercy Hospital, which is part of the Northern Light Health System. Dr. Anderson, thank you as well for joining me.
Thank you. I'm happy to be here.
Dr. Anderson, I'm going to begin with you because as we've been hosting these programs and also a recent Ask Maine Doctor series that we held, a webinar series that we held where we invited folks to ask questions, some of the most common questions that were asked were about women of childbearing age, and in terms of especially women who are considering getting pregnant. And I'm going to ask you to share your personal journey as well in your decision to get vaccinated. But a lot of the questions have been surrounding the sort of vaccine insecurity or questions. And actually, Bright, thank you so much for being brave and joining us as you're considering whether or not the vaccine is for you. I want to make sure to get from Dr. Anderson, first of all, what she's been hearing from her patients and also hear about your story. So let's begin with you.
Sure. So my personal background, I am almost 38 weeks pregnant right now. And I was around 16 weeks pregnant when the vaccine became available to me as a healthcare worker. So I definitely had my reservations with it being a new vaccine and not formally tested on pregnant women. So I took a step back. I spoke with a lot of the specialists that I have access to, including immunologists, virologists, high-risk obstetricians. And I think a really important piece of this is that pregnant women who contract COVID are at increased risk for severe disease. And I've seen that as a physician. So they're at increased risk of hospitalization, admission to the ICU, intubation, and even death. And then there's pregnancy risks that go along with that too, right? Like things like preterm delivery. So, so being a pregnant healthcare worker, I was working in this very high anxiety situation of, you know, am I exposing myself and my baby to risks? And really, when it comes down to it, what's the better decision to move forward with a vaccine that is currently under investigation, or to have the potential risks that go along with COVID. So after speaking with a lot of the experts, I made the decision to move ahead and receive both doses of one of the mRNA vaccines. And I think, you know, we can get into a lot of the questions and details surrounding these as we go, but I felt confident in the safety data and the science that we knew about the vaccine at that point in time to proceed with it. And I think since then, the data has been just so reassuring about the vaccine in pregnancy and the potential protection that it offers, not to just moms, but also to babies once they're born. And we can get into that more too.
Great. Let me also bring Iman into this conversation now, because Iman, you have a story as well that dates back to the very first month of COVID. When was it, that March at the very beginning of COVID, where you suddenly found yourself in a situation where it was happening and it was very real for you? Talk about that and share your story, what you feel comfortable with us.
Yeah. So at the time I was living alone in DC. So I got it, didn't realize I got it because I thought I had a cold, and it progressively got worse over the course of the month to the point where I couldn't think, couldn't really move, couldn't really do anything. And I had a pre-existing condition, asthma, that I've had since I was a kid, but never really it never really bothered me. I didn't need an inhaler. But then once I got sick, I got really sick. My breathing started to get affected. My chest hurt constantly, and it got worse over the course of the month that I was sick. Um, and by the end of it, I was in so much pain that I felt like I was having a heart attack, like I was dying. And the really unfortunate part was I couldn't reach anyone. I couldn't go to a hospital because at that point, DC hospitals weren't allowing people to come in. Um, and even afterwards, it was like really hard to get anyone to really help me out. Even getting an inhaler was difficult. Um, and so after having that experience and still feeling the after effects of it, still have issues breathing. My chest still hurts from time to time. And my inhaler doesn't even really help at this point with that kind of, with those issues. So that experience really shaped the way I viewed the vaccine because I didn't know whether or not I could get it again. No one really knew at the time whether or not you could get COVID again. And so I knew that um, in order to not only prevent myself from getting it, but also giving it to anyone else who could potentially have that same reaction, I knew that getting the vaccine, in whatever form, really mattered.
And now you're fully vaccinated?
Yeah, I got vaccinated early April, and I got the Johnson & Johnson, so I didn't need to worry about a second dose.
Great. Bright, I want to bring you into this conversation because Bright, you are considering, you are weighing your options, and you are deciding. You're an individual who's deciding as to whether or not you're getting the vaccine. What are some of your thoughts as you hear Aman speak and as you hear Dr. Anderson, who made that decision, obviously a very difficult decision as someone who's pregnant? Talk about what your thoughts are and share your COVID story, if you will.
Absolutely. Thank you so much for having me. And it's really great to be here. I'd like to just begin with a few disclaimers. Firstly, I'm speaking on like my own perspective, and I don't want anything that I say to be taken as that of a viewpoint of the whole community. Like, this is just specifically what I think and my experience and what is going through my brain right now. And so I just want to put that out there and make sure that everybody understands that. But I guess for me, it has been really tricky because um, I as well as working for Prosperity Maine, I am also an essential worker. I work for a home healthcare agency, and so I work with disabled people, and I'm in contact with like different people all day, every day. So when COVID started, I was working from home for one of my jobs, but for my second job, I still had to go in and take care of my clients because, like, obviously they had nobody, essential workers had to continue working. So I was in the midst of it. Like, I was in it. I had multiple scares. Like, I was quarantined for 2 weeks at work. Like, it was a very scary time for me. So I definitely understand the severity of the pandemic of COVID-19 and everything all that it has taken from all of us. But I guess just like my questions come from like, are mostly based on like the long term. Like, I have no idea how this is going to affect me in the long term. I see and I understand and I echo the short term benefits. Like, this is huge to have this vaccine that is able to protect people. When you have this vaccine, it's 100% effective in preventing death, and I see that, but I just can't get my brain to go past the long term effect. Like, how is this going to affect me in the long term? Like, is this going to be like an annual thing? Like, are we going to need, if I get my shot right now and potentially have side effects, am I going to have to get another booster shot that's going to potentially give me more side effects? Like, I'm just like not sure what is happening. And another thing is along with Iman, I also have a pre-existing health condition. So I get the severity of this. I get that this vaccine would be good for me, but I just, that fear, that unknown I believe, is greater than me understanding the importance of this vaccine. So I kind of have like one foot in and one foot out. Like, I want to get it, but should I get it? It's really like an internal battle. And I like, I think that fear component really plays a major role in it, because it's not that I'm an uneducated individual. Like I read the facts, like I read the news, like I am aware of all the things, of the pros and the cons. I just can't get myself past that point of just do it.
Well, great. Certainly, you do not need to apologize, and we are certainly very grateful that you have joined us, because your perspective is one that is shared by many others as well. So I think what's important for us to have in this discussion is that these are all inflection points that I think, Dr. Anderson, you have considered.
Mhm.
And Aman, you have considered as well. So maybe talk, Dr. Anderson and Aman, a little bit about your perspective and where you were at and how you wrestled with the very same decision that Bright is wrestling with right now. Dr. Anderson, let's begin with you.
I think I think you bring up such good points, and I had so many of those similar reservations myself. And I think one of the unfortunate realities of what's going on right now is everything has been so highly polarizing and publicized, and it's hard to wade through all of that. And I think the other thing is we're learning as we go. As a medical community, as a public health community, we haven't experienced anything like this before, and it's a novel virus. We don't know how this virus is necessarily going to behave in any given situation, or what we're going to do with the variants that are coming out. And I take a step back to say, I think back last fall, there was all this discussion about this vaccine is being rushed, that it's not going through the proper channels, it's being pushed through. But I think when we look at where we are right now as a country, it's really a testament to our public health systems and our science community and our medical communities, and how they were able to come together and work so well together to rise to this challenge. And nothing has been rushed. The vaccine has gone through all of the necessary checkpoints to get to this point in time. But this mRNA technology was just sitting waiting for this moment in time. The technology is over a decade old. It's been well researched, it's been studied. We've been trialing it for some cancer therapies, HIV, Ebola, different types of things, looking for the right virus to use it in. So I think that's reassuring. It's not this brand new technology that some people are presenting it as. And so I took a lot of solace in that. And then I think, the other thing that I came down to was, when are you going to feel reassured, I guess? What point in time are you looking for? What's your end goal to say, yes, I feel comfortable moving forward with this? So from an OB's perspective, I think the mRNA technology is pretty incredible because it gets broken down so quickly by the human body. I actually wouldn't be surprised if we start using more of this type of vaccine in pregnancy in the future, because we're not using live viruses. A lot of the things we worry about in vaccines are not present in the mRNA vaccine. But a lot of these different things gave me reassurance in moving forward. And again, it kind of came back to, what am I looking for to make this decision? And what am I going to regret? Am I going to regret not getting the vaccine, or regret moving forward with the information that I had at that point in time? I could go into so much more detail about all of this, but
Well,
I'd love to hear Aman too.
I do want to get to Aman in just a moment, but as you were making your decision, Dr. Anderson, I'm thinking you must have looked at sort of the impacts, like for individuals maybe who hope to get pregnant, who you were in the situation, who are already pregnant. Why there are many people that may be watching this that are in that position. I for example, live next door to a nurse who works in a maternity unit, who had chosen not to get the vaccine because she was hoping to get pregnant within
Sure.
that period of time. What did you find out about folks who are in that kind of a situation?
Sure. There is a lot of information out there about the fertility concerns in pregnancy. And quite honestly, it's based on a poor understanding of genetics and science. So the theory, or what's being proposed, is that the vaccine causes an immune response to the spike protein of COVID. And an individual said, well, there's some similarity between the spike protein and a placenta protein. And if you receive the vaccine, you will have an immune response to placenta, so that we would see infertility and increased miscarriages and so on and so forth. Now, if you kind of dig into that, there's several reasons why that theory doesn't make sense. I mean, first of all, people with natural COVID infections, we would expect to see increased miscarriage rates, and that just hasn't been the case at all. But second of all, like I said, I mean, the cross-reactivity, the similarity between the placenta protein and the COVID spike protein is very small. And those who, operate in genetics and immunology know that in order for there to be a cross-reactivity, they have to share about 80% of the genetic sequence. And we're talking about five amino acids that are in the same sequence out of thousands. So it's not a theory that anybody who has any understanding in genetics is concerned about or is promoting, and we just aren't seeing it in our real life. In our real life data, we're not seeing people with COVID infections have increased miscarriage rates, and now we have so many people who have been vaccinated, pregnant and non-pregnant, and we're not seeing an increase in miscarriages from the baseline population rates. And people will talk about statistics, and they'll talk about the VAERS reporting system, the vaccine. Does everybody know what VAERS is? The Vaccine Adverse Events Reporting System. It's a public database that anybody can go into. And there's been some really poor statistical analysis that's been done on that, that says that miscarriages have increased by 400%, but it's statistics that have been done incorrectly. And if we want to go into the specifics of that, I definitely can. But we know, the other piece of this is, we know COVID is risky in pregnancy, and we also don't know the long-term risks of COVID on fertility in general. We know that men with COVID infections have decreased testosterone levels. We don't know how long that persists for. We don't know if that's similar to other viral infections like mumps, where it can be a lifelong consequence, or if it's something that's going to rebound. But I think the fertility concerns thus far are unfounded and really based on poor science. But the concerns about COVID and the lifetime consequences of COVID are something that people need to take pretty seriously.
So I want to get him on in here, but you just mentioned something really quickly, which sort of brought up another question. You mentioned that there are, measured testosterone level differences in men who have had COVID-19. Are there differences that have been measured between the sexes, between men and women, in folks who have had the vaccine? Does the body react differently? The body of a man and a woman react differently? And are there any measured concerns around that? That might be one of the questions Bright might have going into this.
In terms of fertility, you mean? So it's actually really difficult. So what it comes down to for women is, what we care about is the quality of their eggs, really. And that's something that's very difficult for us to study. You basically have to go in and take an egg, and to compare it from one cycle to another is something that's really hard to study. So we can extrapolate based on, miscarriage rates, pregnancy rates, maternal fetal outcomes, things like that. And thus far, it doesn't seem like a woman's fertility risk changes from the baseline, whether she have the natural COVID infection or she receive a vaccine. If she's pregnant, that's different, but I'm just talking about fertility risk in general. For men, we really don't understand what that testosterone level means long-term at this point in time. Does that answer?
And that's specific to the vaccine, the impact of the vaccine?
For men, are
Okay.
you asking? Yes. So for men, we have not seen a decreased testosterone level in men who are vaccinated. It's men who have the natural infection that we're seeing that decreased level.
All right, Iman, I do want to come to you and ask, because you contracted COVID. You were one of the earlier individuals who had contracted COVID back in March of 2020.
Yeah.
You still made the decision to go ahead and get the vaccine. Talk to me about that inflection point and what led you to make that decision.
Yeah. Well, first, I think living in a city when it was really bad, DC was one of the lucky cities, especially in comparison to like New York City, but it dramatically transformed everything about it. And the number of people in hospitals, the fact that you couldn't really go anywhere. In fact, if you were outside and you weren't walking a dog or going somewhere specifically, you were fined $1,000. It was really serious at the peak of it. And so experiencing city life during the height of the pandemic really affected how I saw the virus and how it affected others. Not just me, but especially others. But it wasn't like I was super on board with getting it at first, because I think part of my fears with new vaccines, new medicines, things like that is the history of racism in healthcare and medicine. And the fact that people of color are often left out of trials, especially Black people and Black women. And so that was my biggest worry with getting a vaccine that went through these trials. I know like pregnant women were incorporated, but I was fearful of how many people of color were involved and how it affected people of color. Because historically, we've seen the ramifications of things like that. And I was especially worried because, the Johnson & Johnson versus the other vaccines wasn't considered, the greatest option. It was like a running joke for a while. But you couldn't really pick or choose which one you were going to get. And so the only one that was available to me at the time was Johnson & Johnson. And so was it, do I get this vaccine now or wait a month before, or wait a certain period of time till I can get another option? Or do I just get this because it's available to me right now? So I got it. And then afterwards, you had the stories come out about the people who are developing the rare blood disorder. And it was and the really shocking part about it was all women between a certain age range. And so that was like, oh God, okay. Will that have an effect on me? And will it have effect on anyone I know who potentially get it? And so that was like my apprehension at first with getting it, and like after getting it as well, because that story came out like I think 2 days after I got the vaccine.
You're right in that window.
Yeah, so I was waiting for like 2 weeks just to make sure, nothing weird was gonna happen. And then at the same time, we've got there are so many other vaccines that we get before we travel or before we go to school, and we don't really question it. We don't really think about it. And so it's stuff like that, as well as even tapping into fertility, birth control. We don't really talk about how birth control affects fertility, but a lot of women just readily accept it and take it, and then find out like years down the line that the birth control they had been using for a really long time dramatically decreased their fertility or had a lifelong effect on their fertility. And so when I think about it from that perspective, I was kind of like, okay, it's okay to get a vaccine. I may be, feeling a certain way about it, but I've already taken a lot of other things. So, so I don't think I don't think adding this vaccine, especially a vaccine that, even though we thought it was going to take months, like Dr. Anderson said, they had already made so much progress, with that, with different aspects of the vaccine, that it didn't take as long as we thought it would. And lastly, like, I think the other thing too is just seeing how the rest of the world has been affected by the lack of vaccines. And so India and all these other places are really struggling with not being able to have access to those things, and seeing the numbers of people that are dying. And then I mentioned earlier that in Brazil, there's a huge issue with pregnant women dying and their newborns dying because of the fact that they got COVID, or their pregnant mothers got COVID and were forced to have to give birth to them because they had to pick and choose who was going to live. And the fact that that is an issue happening right now. And we see how pregnant women were included in the trials, and we see, like Dr. Anderson said, that there are way more benefits than not. I just think that the vaccine is very valuable in so many ways, no matter how weirded out you are about it. So yeah, that's my spiel.
Well, thank you for sharing that. That was quite that. You have had quite the story between getting COVID in the early weeks of COVID and then getting the J&J vaccine just 2 days before the announcement. Now, Bright, I'm going to step away and say I'm the middle-aged white man who also got the J&J vaccine. So I think your questions are far more important than mine in this particular context. So why don't I give the floor to you, and you can ask Iman and Dr. Anderson questions that you have in terms of the decision that you are making.
So I guess I would say, okay, I guess my first question would be for myself and those of us, because I'm sure we're out there, there's plenty of us out there who feel like we can just coast through and wait until potentially more people are vaccinated and maybe rely on herd immunization, or just like hunker down and lay low until this passes over potentially. What do you have to say to that, Dr. Anderson?
I think I've got 2 points to respond to that. The first is the patients that I am seeing test positive now are not my healthcare workers or my teachers or even my essential workers anymore, because we know how to take precautions now. We're good at wearing masks and hand washing and social distancing. It's my patients whose brother-in-law comes over and then the next day is symptomatic, who think they're being so careful and they have their bubble. But really, how much control do you have of your bubble at this point in time? I mean, kids are in daycare, people are working, kids are in school and getting back into activities. So I think if we start to break that down, it's getting harder and harder to hunker down as our communities are opening up. And then I think my second point is, I mean, it's Iman. Basically, she's a beautiful example of it. We know that certain pre-existing conditions are gonna predispose people to severe disease. But I have a good friend who's a yoga instructor with no pre-existing conditions that we can identify, who probably has chronic scarring of her lungs and can't walk up a flight of stairs anymore without having to stop. So I think, I mean, that would be my response to the hunker down. It's risky, I think, to try to take a step back and wait. And I really just encourage people to keep asking the questions, to find a healthcare professional that you really trust, and to have like this very, very honest conversation. But I do worry now that mask mandates are coming down, that we're starting to see more and more of our vulnerable population exposed.
Absolutely. Iman, do you have something to add?
Yeah, that's my biggest worry too. It's just, I think it's one thing if we all continue to, keep those precautions in place, but as like the world opens back up, we're seeing people really take advantage of that. And and just, we don't know who's vaccinated, who isn't. And that's like the biggest issue too, is living in a city and things like that, people will do whatever they want. And you, no matter how careful you are, like Dr. Anderson said, you can't trust. you know, in all honesty, yeah, it's really difficult because there are going to be people who lie. There's a huge issue right now with people getting fake, vaccine cards and using that instead of actually getting the vaccine. So I I'd rather take that risk of getting it than not and possibly getting it again. Yeah.
So my next question then would be, okay, so we know there has been a couple of cases of people who have gotten COVID even after being vaccinated. So how severe are the long-term effects, side effects, like for example, like the lung scarring that you mentioned, Dr. Anderson, like how severe is it in a person who has gotten vaccinated versus somebody who has not gotten vaccinated?
Yeah, that's such a good question,
Yeah.
right? So currently, what we know to be true is that the vaccine has a 90 to 100% success rate in preventing severe COVID disease. So people might come down with COVID, but because their immune system is primed and ready, they're not getting the severe COVID that requires hospitalization. And as far as we know right now, has the long-term ramifications of COVID without the vaccine. So that's really the important point when people are saying, well, the vaccine's not working, people are testing positive. It's not necessarily the positivity rate, it's the severe disease that we care about and that we're looking at. And so far, it seems like it's doing a really good job in preventing the severe disease.
All right. Okay. That's pretty good. And then my other question would have been about the fertility, but you have already thoroughly answered that. And it's good to see that you, as a pregnant woman, have gotten the vaccine and alive and well.
Yeah. I'll say too, every female in my office has gotten the vaccine too. Okay. So I mean, that's a wide range of, doctors, physicians, our secretaries, our medical assistants, our lab techs, I think we really, we stand by what we're saying. It's not just me stepping out and saying this to put a good face on the vaccine. It's personal.
Great. Yeah. That's a very important part. It's personal. And as for people who are not sure as to which vaccine to take, after Johnson & Johnson being recalled, and even though it's back on the market, people are still apprehensive about it. And so what advice would you give to somebody who is not sure which vaccine they should get? Like, personally, I don't understand why a vaccine that's only 66% effective is on the market, but that's just my personal opinion. So what would you say to somebody who doesn't know which vaccine?
Yeah. So my advice is the best vaccine for you is the vaccine available to you. So one point I really wanted to make about the J&J vaccine is really the pause that happened should give us so much reassurance about the monitoring that's going on across the country right now. It was 7 to 10 people who came down with this rare blood disorder, and they paused the whole thing. So we really are keeping such a close eye on the side effects and consequences of these vaccines. Now, my pregnant patients, it's a little bit different because pregnant women are at increased risks of clotting disorders. Just because of pregnancy. So for my pregnant patients, I am saying if an mRNA vaccine is available, you should opt for the mRNA vaccine. But otherwise, it's whichever vaccine is available.
So could you explain then the difference in what does it mean when they say like Johnson & Johnson is 66% effective, but Pfizer and Moderna are like in the 90s? Like what is that?
So again, we're going back to look at the positivity rate. So people who are testing or coming down with a novel infection versus the severe disease rate. So the Johnson & Johnson is still upwards, it's around like 80 to 90% effective against the severe disease, with some reports being even higher than that. So the J&J vaccine might not be doing quite as good of a job as preventing just a positive case, but it is preventing hospitalizations, intubations, and severe disease. And really, you know, when it comes down to the nuts and bolts of it, that's what we care about, is keeping people from those long-term ramifications.
Yeah. All right. Well, thank you so much. I feel like my questions are adequately answered.
Good.
And what a great conversation that was. We thank our three guests. We thank Aman and Bright and Dr. Anderson for joining us on this community action. They did a fantastic job. You may not have even noticed that I was there. As a matter of fact, about halfway through the interview, technology did its thing and my computer started an automatic update of programs and did a shutdown. So I suddenly left the conversation, not of my own will, because I certainly enjoyed watching and being a part of it. But thank you to my colleague, Sherry Locke, who stepped in there at the end. You may have seen her pop up, and she didn't even need to say anything because our three guests did such a fantastic job in discussing a very important topic that many folks have a lot of concern about. So thank you to them. And before we leave you on this edition of Community Action, for those folks who are wondering or who are asking about how they might get their vaccine or get more information about that, we wanted to share the following information with you. First, the state of Maine COVID-19 vaccination website, maine.gov/COVID-19/vaccine. This will provide you with the information about some of the sites that are providing appointments or even walk-ins. You may also hear or connect directly with your healthcare provider about getting a vaccine, or you may want to contact the locations that are displayed on this website. Again, maine.gov/COVID-19/vaccine is a great site to go to get information about vaccines statewide or vaccine opportunities statewide. And we also want to remind folks that there's the COVID vaccine line that's available at 1-888-445-4111. It's open Monday through Friday from 7 a.m. to 7 p.m. and on weekends from 8 a.m. to 2 p.m. This helps individuals across the state of Maine get information about vaccine clinics. So you can call this number, you can check the website out. There's also the opportunity to get translation services in various languages through this line to serve Mainers who speak a number of different languages as well. Again, this is another opportunity, that number 1-888-445-4111. And also a reminder that there is a transportation available to vaccine appointments with a 48-hour notice. Please call 1-855-608-5172. If getting to an appointment is the impediment for you, the free vaccine ride program offered through the Department of Health and Human Services is available to you. Contact this number if that is something that you are requiring assistance with. And we thank you so much for joining us on this edition of Community Action. Thank you to our three wonderful guests. They did a great job and continue the conversation, and I certainly appreciate that. We'll be bringing you another edition of Community Action sometime soon, so be on the lookout for it. Thanks again, and have a great rest of your week.